This video provides information from the internet, and we do not promote any products or medicines. Always consult a doctor before using any medication. We are not responsible for any side effects or issues resulting from self-medication.
Glycohale Respules is a medication designed to assist in managing chronic obstructive pulmonary disease, COPD. It helps patients breathe easier and reduces related symptoms. Indications and uses. This medication is indicated for the maintenance management of airflow obstruction in patients with chronic obstructive pulmonary disease, COPD, including chronic bronchitis and emphysema. It is crucial for alleviating symptoms that significantly impact the quality of life, such as shortness of breath, chronic cough, and excessive sputum production. Glycohale Respules provides a long-term solution to help maintain lung function and improve daily activities for individuals affected by this debilitating condition. How it works. Glycohale Respules works by blocking the action of acetylcholine, a chemical messenger in the brain that causes the muscles around the lungs to tighten. This leads to bronchodilation, easing breathing and reducing COPD symptoms. Directions for use. Use Glycohale Respules as directed by your healthcare provider. It is strictly for oral inhalation only and is administered via nebulization with a nebulizer, which may be equipped with either a face mask or mouthpiece connected to an air compressor. Ensure to follow your doctor's instructions on how to utilize the nebulizer properly. Avoid exceeding the recommended dose, as your physician will establish the appropriate dosage and duration based on your age, body weight, and the severity of your condition. Possible side effects. Common side effects include shortness of breath and urinary tract infections. If you experience worsening symptoms or new side effects, consult your physician promptly. Precautions and warnings. Caution is advised when using this medication in pregnant or breastfeeding women, and it should only be used if clearly directed by a healthcare provider. Additionally, individuals with kidney disease, glaucoma, or urinary issues should inform their physician before use. This medication is not recommended for individuals under 18 years of age. FAQs. 1. Why is this medication prescribed? It is used for the maintenance management of airflow obstruction in COPD patients. 2. How should it be taken? It is administered through a nebulizer as per physician instructions. 3. What are common side effects? Shortness of breath and urinary tract infections are common. 4. What if I use too much? Seek immediate medical help if an overdose occurs. 5. Is it safe to drive after using it? It has no significant effect on the ability to drive or operate machinery. Thank you for watching. We hope this video provided valuable insights. Please feel free to leave your questions or suggestions in the comments below.